You know, families back home are really counting on us to work in this committee and across the appropriations in a timely bipartisan way so we can pass our funding bills that keep them safe and our country strong. So I'm really glad this committee is continuing full steam ahead with return to regular order and talking about making sure that FDA has the resources it needs to live up to its really critical mission. Because make no mistake, protecting our families is not just about how strong our military is. It is about how safe our food or drugs or our medical devices are, not to mention how smooth our supply chains are to ensure that families get what they need. We've had some tough reminders of that over the years, whether it's the medical supply shortages during the pandemic or the agency's important work to quickly, safely review COVID treatments and vaccines, or, as we've talked about here, the inexcusable baby formula shortage. That is really why I pressed very hard to make sure our end of the year package last year included some really important reforms to FDA. But we have more work to do, including on this subcommittee, to make sure we provide the resources for all of this as well. Because there is a direct line between FDA having the resources it needs and the safety of American families. Every time families back in Washington State go to the grocery store or gather around the dinner table or fill a prescription or rely on a medical device, they're really putting their trust in FDA and their experts to uphold the gold standard of safety and effectiveness. And let me just say once again, especially in light of recent events, the determination about whether drugs are safe and effective needs to be left to the experts at FDA, not politicians and certainly not judges. We got a stark reminder of this in the recent weeks when in extreme, poorly reasoned, and dangerous rulings, judges undermined FDA's authority to review and approve drugs by declaring themselves to know better than FDA's experts about medication abortion. FDA has an enormous responsibility and some hard work ahead to make sure it is living up to that responsibility. The last thing our families need at this critical moment is for politicians to undermine its authority or shortchange its efforts. So I'm really glad today, Dr. Califf, to have you before this committee to talk about what the agency is doing and what it requires to tackle the challenges you have ahead. And I do want to start out with the mifepristone issue. As you know, the Supreme Court is going to decide a case that really threatens access to medication abortion nationwide and seeks to undermine the FDA's authorities to approve and regulate medicine. Let me ask the question this way. Commissioner Califf, would you speak to the implications of this case on the drug approval process and the scientific rigor with which the agency approaches drug applications?
Well, as we've discussed already today, our decisions are based on the latest science, the best data we can find, the weighing of risks and benefits by professionals who are full-time civil servants without financial conflict. And there is concern in this case about the impact on a wide variety of things, including patients, women who need access to a drug which is approved, the pharmaceutical industry itself, because of the threat to the separation of this decision about what's approvable and what's not, sequestered away from political influence. So these are all concerns that we have.
So I take from your answer that this, of course, could have an implication on mifepristone, but also on the process that all of the drugs and tools that are going through the FDA.
This is well reflected in the extensive briefs that the Justice Department has filed on our behalf and are publicly available.
Thank you very much. Dr. Califf, at the end of last year, as you know, I negotiated and passed the Modernization of Cosmetics Regulation Act of 2022, which Senator Collins, who just left, was a critical part of. It provided new authority to your agency to make sure that cosmetics are safe for the people who use them. The FDA finally, after many years, will know who is making and marketing what products and where and what ingredients are being used, and when there is an adverse event like severe rashes or hair falling out or worse. This is the first time, and I'm very excited that you now have the authority to regulate. I can't tell you how many people I've talked to who didn't even know they weren't regulated before. So a very important step. You will now have the power to take products off the shelves if they're not safe. Can you provide us with an update about how you're moving forward with this new authority, and importantly for this committee, what resources you will need to implement them?
Sure, I'm still stunned by the average of 12 cosmetics a day for women and 6 cosmetics a day for men. Now, something I hadn't really considered before, but I am pleased to say that we're on track, and I'm really excited that we've moved this under the auspices of Dr. Namanje Bumpus, who's our chief scientist. If you all have not met her, I would urge you to meet with her. She was the chair of a department of pharmacology at Hopkins, and I tried to talk her out of coming to FDA because she had a good life as an endowed professor, but she's a great civil servant and a preeminent scientist in that role. We're moving along well with the registration issues that are part of this, developing the adverse event system. We've asked for $5 million for next year, which is a very important part of the budget. Our estimate for the overall dealing with this $70 billion a year industry is about $40 million to get us where we need to be over time. And we'll phase that in so that we can show progress. I know I've learned we need to show that in order to get people interested. But there are real safety issues that we're encountering, so I'm glad we have that opportunity.
Okay, thank you very much. Thank you, Mr. Chairman.